Constantly holding tension in your middle and upper abs throughout the day can limit how well you can breathe, how your diaphragm can function, how your pelvic floor can function, and even healing of your diastasis. One easy trick to throw in throughout the day is some skin rolling and breathing. So what we're going to do here is you're going to roll up your shirt and you're going to find a piece of skin. I usually find kind of coming off to the sides is an easier place to start with it. And you're just going to take that skin and then you're going to glide your thumbs down as you walk your fingers along it. So you're just going to walk down here, going down and then coming up, finding areas that feel a little bit sticky. And as best you can, you're trying to get the top layer of skin versus grabbing kind of a bigger chunk with it. So trying to just get that top bit as best you can helps those areas kind of glide and let go. And especially if you're kind of always holding in that area there, then that area doesn't get mobilized with every breath or movement that you take. And this is a way where basically when you're gripping, it's kind of like you've taken saran wrap around an area and taken a hairdryer to it and everything just gets stuck down. So we're trying to separate those areas in theory kind of and just get things to let go. So you're going to go up and down in different places. You can come a little bit more towards the midline, up and down. You can go across, you can go at an angle, and checking on the other side as well. If you have a diastasis or a hernia, definitely just being gentle and easing into those areas, seeing how it feels, seeing how your body responds, not being really aggressive to that spot. But the other thing you can do is you can get to that spot, particularly if you get up and around your diaphragm here, so where your ribs come into the middle with it, and you can hold there, and then you're going to inhale and then exhale. Nice and easy. So you're holding that tension while you inhale. So it's a mobilization with movement, getting that tissue to move one way while you're kind of pulling it another way, and then exhaling, letting go. I really like doing this kind of on one side, and it just has to be like 30 seconds or a minute or so, going in all those directions and not doing it on the other side, and then taking a breath in or seeing what your abs look like or trying to contract your abs with an exercise afterwards. And it can really help magnify like, oh, that really did help. I do feel that area moving a little bit better compared to the other area that I haven't worked on, versus doing kind of like breathe first, do both sides, breathe again. It can be a little bit more of a subtle change with it. But give that a shot. See if that just gets those areas to let go, before you yell. Grab onto those spots. If you're going to project your voice or anything like that with it, that can just get those spots to down regulate and relax a little bit more, so you can kind of have a better resting tone and position, so everything has a better chance to be able to engage and function from there. I also like thinking of it as kind of like a fidgety exercise to get done throughout the day, where you don't have to have equipment or anything like that. You can be sitting in the car, watching your children eat, just anything, kind of throwing it in there. So then when it's time to do your exercises, you're more kind of primed and ready and have given your body that reminder throughout the day to get those areas to let go. So hope you enjoy that, and it helps things just kind of relax a little bit better and give you a better foundation to move from.